fossa. In the temporal fossa, you have an important area which is called the pterion. The pterion is where your parietal bone meets the greater wing of the sphenoid. So, nag-articulate sila, no? What's this? Parietal bone and greater wing of the sphenoid. This is frontal. This is, what is this? Temporal bone. The squama, or the squamous part of the temporal bone. So you have that H-shaped suture. The area where you have that H-shaped suture is called the pterion. So take note of the spelling again. Mali ba? It starts with the letter P, no? Alright, so pterion. And inside the cranial cavity, this is still the pterion. Take note of these blood vessels crossing the pterion inside, that is the anterior part of the middle meningeal artery. And this pterion is this is the thinnest part of the temporal bone. So if you bang your head, o nahulog ka na, o nahulog, o kaya kahit na yung contre-coup, yung bumagsak ka pero nagkaroon ka ng fracture, kahit kapatayo, no? Contre-coup. This fracture of the pterion might cause laceration of the middle meningeal artery, causing bleeding, which is epidural. No? Epidural hematoma results from epidural bleeding. Now, the next one, this is the infratemporal fossa. Okay naman nila? Mga tetens tuloy. So this is the infratemporal fossa. It is below, this is temporal fossa, right? Yung temporal fossa, yan yung pterion. So meron ditong zygomatic arch, no? Nandito yung ramus of the mandible. Dito pala. Alright. So ito yung boundaries ng infratemporal fossa. Anteriorly, you have this. What is this bone?
Maxillary.
Medially, what is this? Pterygoid plate. Lateral pterygoid plate. Ano to? Sa likod?
Styloid.
Styloid process. And then this is covered laterally by your ramus of the mandible. So you have that infratemporal fossa. This is the infratemporal part of the sphenoid, greater wing of the sphenoid. That is the infratemporal crest. Alright, so these are the muscles contained in the infratemporal fossa. You have the lateral pterygoid, no? And this is medial or internal pterygoid. Alright, the lateral pterygoid, take note, it has two origin from the greater wing of the sphenoid, from its infratemporal part, and this is from the maxilla. And its insertion is in front of the neck of the mandible. And this is the medial pterygoid. No? Ito pala ang origin pala ito, lateral surface of the lateral pterygoid plate. Itong isang part ng lateral pterygoid muscle. This is the internal pterygoid, no? Internal pterygoid. Ito yung merong part sa maxilla at saka medial surface ng lateral pterygoid plate. Yan. So its insertion is into the inner surface of the ramus of the mandible hanggang sa angle. Yan. What is this muscle, by the way?
Buccinator.
Buccinator. What is that?
Stenson's dog.
Galing naman. Okay. So, ito yung nerve in the infratemporal fossa. This is the mandibular nerve. No? Tandaan nyo kanina, yung mandibular division ng trigeminal pumasok sa foramen ovale. Dito siya lumabas sa infratemporal fossa. And in the infratemporal fossa, it gives rise to two divisions. A small anterior division, which is primarily motor, and a posterior division, which is bigger, which is primarily sensory. No? So this is the motor division of the mandibular nerve supplying the muscles of mastication. That is the masseter, and this is the it supplies the medial pterygoid and the lateral pterygoid. And this is the sensory division. It gives rise to the auriculotemporal nerve, and it gives rise to the lingual nerve and inferior alveolar. Together with the only motor division or motor component of posterior division, this is the nerve 2, what muscle? Mylohyoid. And, ito pala yung sensory part. The only sensory part of the anterior division is the buccal nerve. Buccal. No? Yun yung only sensory. And, this is still, yan. Ito yung mandibular, this is the mandibular nerve, trigeminal ganglion. This is the otic ganglion that I mentioned earlier, and these are the, this is the lesser petrosal. And, ito ay inferior alveolar, this is lingual nerve, no? Lingual nerve which is joined by chorda tympani. Ito yung facial nerve sa middle ear, it gives rise to this chorda tympani which will join the inferior alveolar nerve. Hindi inferior alveolar, lingual, no? Lingual nerve. And this is the inferior alveolar nerve, and this is the nerve to the mylohyoid, and that is the inferior alveolar nerve that will be running through the mandibular canal, supplying the lower teeth. And these are the blood vessels inside the infratemporal fossa. You have there the maxillary blood vessels, the maxillary artery. And this is the pterygoid venous plexus. This is the deep facial vein communicating with the facial vein. Ito. This is the superficial temporal vein that will be joining the maxillary vein. Dito tatlo sila. And what is formed by the union of the superficial temporal vein and maxillary? This is called the retromandibular nerve. And that retromandibular vein divides into two, a posterior and anterior division. The posterior division will be joining with what is this vein? Posterior auricular, and ano yung resulta nito?
Facial.
This is external jugular vein that will be running superficial to, what is this muscle? Sternocleidomastoid. And this is the anterior division of the retromandibular vein which will be joining with the anterior facial vein, forming the common facial that will be joining or draining into this big vein. What's that? Internal jugular. Ayan. Then we go to the nose. The nose. Skeletal support of the nose. Ayan. So, paano naging matangos ang ilong mo? Ganito. So, meron kang nasal bone. No? Kung yung nasal bone mo ay nakadapa, ay di dapa din ang ilong. So, this is the nasal bone. This is paired, small bone that are paired. And this is already the, what is this bone? Maxillary, no? Frontal process of the maxilla. And what about this one? These are the nasal cartilages. Ito, pagka we have the preserved skull, kaya yung preserved skull, wala na siyang ilong, ito lang natitira, no? Kasi cartilaginous yan. So, ito lang mga gilid na yan ang natitira. And this is from, looking from below, these are the nasal cartilages, no? Alar cartilage. Ito yung nasa baba. And this is your nostril, no? Or anterior nasal opening. And this is the nasal cavity. This is a coronal section of the nasal cavity showing the nasal cavity. This is what? Nasal septum, and these are the conchae. Inferior, middle, and what is superior? Alright. So, ito yung nasal cavity. And this is the nasal septum that separates the two nasal cavities. No? So it is covered with mucous membrane. And what are the skeletal support of the nasal septum? You have the perpendicular plate or vertical plate of the ethmoid. And then from below, ano yung nasa ilalim? Vomer. No? And the rest would be cartilage. Septal cartilage. So yeah. This is the floor of the nasal cavity formed by the hard palate. This is the posterior opening of the nasal cavity. Ang tawag doon ay
Concha.
guane. Ayan. This is the lateral wall. Lateral wall of the nasal cavity, which has the following features. These are the conchae. No? So inferior, middle, and superior. superior and middle conchae. These are the skeletal support is made up of ethmoid bones. Ethmoid. Kaya ito, nawawala din sa preserved skull. Kasi ethmoid is a delicate or paper-like bone, so nawawala yan. Now, ito yung area ng roof of the nose. This is where the olfactory nerve endings are located. So, dyan, sa area na yan. So, this is inferior nasal concha. This is an independent bone of the face. So, laging nandyan yan unless nadurog na yung ilong. No? So, this is the inferior meatus where you have the opening of what duct? Nasolacrimal duct. And this is the nasopharynx where you have that opening, eustachian tube. This is the torus tubarius. So this is pharyngeal toxin. These are the paranasal sinuses. You have, what is this? And this is, ito, ethmoid yan. Dito ay sphenoid. Ito ay maxillary. Alright, so those are the paranasal sinuses. The paranasal sinuses are lined by the same mucosa from the nasal cavity. Kaya kung palagi kang sinisipon, it is likely that you will have also sinusitis. Then you have the oral cavity. Ito ang bilis nila. Nakakapanik naman sila. Oral cavity. So this is the oral cavity. It consists of two divisions. Ito ay oral cavity proper. Ang anterior boundary niya ay lips at saka itong cheek. No? So yan. And then this is the oral cavity proper where you have the tongue. No? And it is roofed by the hard and soft palate. No? The communication, posterior communication of this oral cavity proper is through the is with the pharynx through what is this opening called? Oropharyngeal isthmus or isthmus of Bosse's. Now, so you have there the nasopharynx. This is already oropharynx where you have that lymphoid organ which is called the palatine tonsil. Ito ay pharyngeal tonsil. May tonsil din dito sa lateral wall ng nasopharynx. Anong tonsil yun? Tubal tonsil associated with the eustachian tube. Kaya mayroon kang torus tubarius, mayroon tonsil beneath. No? So ito oropharynx and this is already laryngopharynx. Itong area ng pharynx na yan that is supplied by the maxillary nerve. This is supplied by glossopharyngeal. Ito naman ay vagus. Sensory yung sinasabi ko. And this is the oral cavity when you see it from the frontal view. No? A widely open mouth, and so you can see that communication between the oral cavity proper and oropharynx. And on the lateral wall of that oropharynx, you have this
Tonsils.
palatine tonsil. No? This is soft palate. What is this? Uvula. Uvula. And this is the palato, glossal fold, palato, pharyngeal fold, in between which you have that palatine tonsil or facial tonsil. And then you have the tongue at the floor of the mouth. So it has this oral part. This is the anterior two-thirds of the tongue, and that is the pharyngeal part of the tongue, where you have this elevations on the surface, which is formed by the tonsil beneath. So you have another tonsil beneath the mucosa of this part of the tongue. Ang tawag dun ay lingual tonsil. Ito yung palatine tonsil mo. And the anterior two-thirds of the tongue is marked by this depression, separating it from the posterior one-third. This is called the sulcus terminalis. And that depression is a blind opening, foramen cecum. Yan. So this anterior two-thirds of the tongue is supplied by lingual nerve with ordinary sensory fibers, no, for general sensation, and this is also supplied by chorda tympani, which is for taste. The posterior one-third, this is supplied by fibers for general sensation by the glossopharyngeal, and it is also supplied by the glossopharyngeal with spatial taste fibers, no? Yan. So posterior one-third.